Welcome to Myo 360, the podcast, where we'll delve into all topics related to myofunctional therapy, including airway health, snoring, TMJ, tongue ties, thumb sucking, and even bedwetting. As a myofunctional therapist and a formal dental hygienist, I am sharing stories and tips to help you identify if myofunctional therapy is right for you and how it works to improve your overall health. Join us while we explore the ever-growing world of myofunctional therapy. We have one goal in mind: to help you and your family live your best life. Hello and welcome back to Myo 360, holistic solutions for snoring, TMJ, better breathing, and better sleep. I am your host, Becca Rose, with Myofunctional Pathways. Today, we're going to talk about sleep, snoring, sleep apnea. What is it? Why does it matter? And what happens if we don't address it? All right. So, can myofunctional therapy silence your nights? Let's find out. So today, like mentioned, we are talking about sleep, specifically noisy, disruptive sleep, snoring, jerking awake, waking up the family because we're snoring so much. So we know that snoring can be a very serious condition. All right. Even more serious than snoring is sleep apnea. But there's a solution, and it might involve not needing to depend on your CPAP machine. So we're going to dive into that a little bit today. So what is it anyway? What is snoring? Snoring is that rumbly sound. We all know what it is. It happens when your airway gets too narrow when you're sleeping at night. There's also things to think about with how much air is going into the mouth, and is the tongue muscles and the other muscles in the mouth and the throat weak and collapsing. All right. So yeah, we can have relaxed throat muscles, a large tongue. Even if your tonsils are really big, that can play a role in snoring and possibly sleep apnea. Okay. Snoring itself is not normal. I'm going to say that again. This is a really powerful statement, and I've been using it a lot lately because people understand it, and it's a truthful statement. Snoring is the sound that your body is making when it is struggling to breathe. Let's say that again. Snoring is not normal. It is the sound your body makes when you are struggling to breathe. Now, think about that when you're looking at your child or your partner or, your baby even. Babies snoring, please get some help, because that is not normal. It's not normal for any of us to be snoring. But if a baby is snoring, yeah, there's lots of concerns there. Okay. So talk to your doctor or find somebody who is a specialist in airway function in babies. Reach out if you have questions about that, and I can help direct you into the right direction. Okay. So anyway, so snoring. Okay. Too much air, muscles are relaxed, the airway is closing and collapsing, and the volume of air that you're breathing in is also playing a role in that. But let's talk about sleep apnea a little bit. We all know that. We've heard the term, but sleep apnea is usually a sign that there's something serious going on, okay? When you are dealing with sleep apnea, your airway is actually completely collapsing. There's lots of different collapses, if you will, of the airway. There's sleep disordered breathing, which is really an umbrella term for a lot of different sleep and breathing related issues. So sleep apnea is like the most severe. We all have heard of it. We all know what a big deal it is, okay? If you stop breathing, this happens hundreds of times a night. All right. You may wake up gasping for air. It's going to disrupt your sleep cycle. You're going to be exhausted. Untreated sleep apnea can lead to a number of health risks and down the road. Okay. First of all, we've all heard the news stories of somebody who has sleep apnea. They couldn't wear their machine. They didn't like it. It wasn't comfortable. They just didn't wear it. And then the very unfortunate thing is that they didn't wake up in the morning. That is obviously the worst case scenario. We don't want to be having those conversations or even thinking of that. So if you have sleep apnea or I suspect you have sleep apnea, please get a sleep study, have it diagnosed by the appropriate doctor, get the appropriate equipment that you need. And then if you are having trouble with the equipment, don't just quit. Reach out to someone like myself, find a myofunctional therapist, especially someone like me who also specializes in sleep coaching and functional breathing and buteyko breathing, because it's not just about the collapse, it's about the breathing. And if you're having trouble with your CPAP machine, because a lot of them now, they change air pressure all throughout the night. So you might go from a comfortable air pressure to all of a sudden, whoosh, you get this huge like burst of air. And sometimes that in itself is what is waking people up. But I have proven clients that we improve the breathing during the day, we strengthen the muscles, we then improve the breathing at night, and your body doesn't need to take in as much air. The CPAP machine gets much easier to use, and your volumes of air stay consistent. And your machine can actually track like how many episodes per hour per night you're having and what your volume of air, like what the machine changes the pressure throughout the night. You can keep track of that. So that's a measurable way for you to say, yes, this myofunctional therapy and breathing reeducation is helping me significantly. And that's what my clients that have CPAP machines have said and continue to say as we work together. Hugely impactful. So don't just give up on your equipment if it's uncomfortable or the pressure is waking you up at night. There's lots of things we can do to help you. Okay, so if we don't treat that sleep apnea, we already talked about worst case scenario. God forbid we don't wake up, okay? Untreated sleep apnea also increases the risk of heart disease, and it's disrupting your breathing while you sleep. We know that. Then that reduces the oxygen levels in the blood, and it puts strain on your body because your heart gets strained because it's trying to oxygenate your brain, oxygenate your body. And that strain on your body can increase your risk of heart attacks, stroke, and even heart failure. Another thing that's common to see is high blood pressure. So when you are having an apneic event at night, this can be measured like through your doctor and specialized sleep equipment. But as the oxygen drops, then the blood pressure increases because again, the body is working overtime to try to pump the blood to the body, to the brain, get the oxygen out of the blood and into the tissues and into the organs where it needs to go. Daytime fatigue, we all know this. We know people who probably have sleep apnea, but they don't want to address it and they're exhausted. Untreated sleep apnea can also affect your job. If you have a certain type of driving job and you need to maintain certain endorsements on your license to be able to do your job, if it's not treated and it's known, you can lose your endorsements. So that's pretty big if it gets to the point where it affects your job and your livelihood. But fatigue in general, right? We don't do well at work. We're tired. We're exhausted. We don't do well at school. And let me say that it's not just adults that can have sleep apnea. Okay. So just keep that in mind. Maybe we don't do well in school. We have trouble concentrating. We don't want to do anything, lack of motivation. We feel lazy. We don't have the energy to play with our kids or our grandkids. So daytime fatigue is very impactful to your overall quality of life in general. Okay. Then we think about mood issues. I know when I don't get enough sleep, I am very, very cranky. And I get really, I don't want to say angry because I'm not angry, but sometimes I get angry and I get mean sometimes and I take it out on other people. Usually my family. Don't we all do that? So when I don't sleep well, my family knows it. All right. And I'm not trying to be, mean to them. I'm not trying to take it out on them, but we have trouble with mood regulation when we're very tired. And then, we're irritable and we're aggravated and we're just more easily frustrated. We all know that, right? Okay. even, I mean, think about your eyes, right? So that's not something we usually think about when we think of sleep apnea, but you could over time start to have vision problems. It's linked to problems such as glaucoma. And again, when you think back to the oxygen and the high blood pressure. And those are things, and diabetes, we'll talk about that in just a minute. Those are things that also really affect our eyes. And if you've ever had an eye exam or you're a diabetic and they say, make sure you have your eye exams, or you have high blood pressure, make sure you have your eye exams, because your eye doctor can see different changes in your eyes based on symptoms you have. And sometimes their screening can be like a suspicion, and you're like, hey, have you ever looked into this? So your eyes tell a big story as well. Okay. Diabetes type 2 especially is a big risk factor for untreated sleep apnea. And then weight gain. And that makes sense too, right? Weight gain, because when we're tired, what do? We reach for the sugary, junky foods because the body is craving some sort of energy to keep functioning. The brain needs the carbs to function. And then we overcompensate in the food, in the bad choices, because we're exhausted and we're just trying to, okay, I just got to get through the day so I can go to sleep. And then when I wake up in the morning, I'll feel better. But then this process kind of happens over and over and over and over again. Because again, you're not sleeping, you're waking up, you stop breathing, your heart is stressed, your organs are stressed because they're not getting enough restorative sleep. And your brain is like, come on, guys, I need some help here. Give me some help. And then we just keep this cycle going over and over, day after day after day. And that's when a lot of these really big medical concerns can start to pop up. All right. You know enough already. You know enough about the concerns of sleep apnea and untreated sleep apnea. Again, don't give up if you're having trouble. Reach out, we'll have a conversation and see if I can help you, because the last thing you want to do is shorten your lifespan or the quality of your life because you're having trouble with your machine. Okay, we can work on that together. All right, so what do we do, right? What do we do with myofunctional therapy? Think of myofunctional therapy as a form of physical therapy. We can't call it physical therapy necessarily because it's not, but it is at the same time because we're working the muscles of the face that improve the function of your breathing, of the strength and coordination of your tongue and your soft palate and your face and your neck. All these muscles work together and they need to stay strong and they need to work together. Okay. So myofunctional therapy it's kind of like a blend of type of physical therapy or muscle therapy and almost yoga. Think of it as a blend of those two things. They're designed to strengthen the muscles. We retrain the muscles. This is neural re-education or neuromuscular re-education. What's really great about myofunctional therapy is that because there's that neural re-education portion, your body is going to literally make new neural pathways to your muscles. And that's a fancy way of saying you're going to create new muscle memory. And once you create that new muscle memory to the point where it becomes a habit, it becomes habituated to the point where you don't need to think about the steps anymore and your body does it automatically, you are literally going to continue to do myofunctional therapy without even realizing it, without even thinking about it for the rest of your life. Every time you swallow thousands and thousands of times a day. So sometimes, the thought of, oh, myofunctional therapy, this is a long process. Yes, it is, because it takes time for nerves to regenerate, regrow, repattern. It takes a little bit of time. So I don't ever want you to feel overwhelmed by the process, because if you think about the long term, hey, we can help improve our sleep apnea. We can make our machine feel better. Maybe we don't even need the machine anymore, because that happens too. The upfront cost of myofunctional therapy feels a little bit of a burden, but think of down the road how much money you'll actually save by having control of things now versus having to keep spending more and more and more money when health starts to decline even more. All right. We also need to, so we're retraining the muscles, we're re-educating the muscles. We need to have good tongue posture. Our nasal breathing has to be on point. And we're aiming to create a normal, healthy, functional oral face swallow pattern. Okay. We're improving muscle tone, function, and literally this can help to keep your airway open. I've said in other episodes, and I say this a lot because you understand the visual. If you're snoring at night, and we talked about taking in too much air too quickly, the muscles are not strong, they're weak, so they are more easily to collapse and vibrate. If you think about drinking out of a plastic water bottle, like a disposable water bottle, and you drink all the water out and then you keep sucking, so you're sucking out the air, and then the bottle collapses on itself. So imagine drink glug glug glug, and then you suck the air out, the bottle collapses on itself. That's a good way to think about what's happening when you're sleeping, when you're snoring or having sleep apnea, how that airway just collapses on itself, and then how hard it's going to be to get the right amount of oxygenation and air through your airway space, okay? There's a lot of research out there that supports and confirms the efficacy of myofunctional therapy in being an adjunct to sleep apnea. Now, nothing can cure sleep apnea, so I want to make that clear. We are not curing it. We are not doctors, so we're not diagnosing anything. And as I said before, don't ever stop using any sleep equipment or any equipment prescribed by a doctor without them doing the correct tests to confirm that it is safe for you to do so. So don't ever stop that CPAP machine unless you talk to your doctor, or maybe, like I said, work with us and try to get the breathing under control so the machine works better for you, okay? One of the best studies out there was done a couple years ago by Dr. Sharus Zaghi. He is an ENT out in Los Angeles, and his study concluded that with just myofunctional therapy, an adult could see a reduction in sleep apnea events of 50%. So you're reducing sleep apnea by 50% in an adult with myofunctional therapy, and 62% reduction in children. And that's a really huge number because there's a lot of other things to think about when you're thinking about sleep apnea. So, the machines, there's also certain kinds of devices that can go in the mouth that your dentist can make that help to keep the jaw forward and keep the tongue out of the way. Those are also, a lot of people can't tolerate those well either. They're big, they're clunky, the mouth opens, they're mouth breathing at night. And so they're not having sleep apnea, but because it's keeping the airway open. So those devices are called mandibular advancement devices, or MAD, a MAD device for short. And it has the equivalency of gold standard, the same as a CPAP machine. So don't discontinue a product like that either until you've been cleared by your professional, the one who prescribed it for you, okay? But the studies show that the airway, or the myofunctional therapy, strengthens the airway, keeps the airway open, and reduces apneic events by 50% in adults and 62% in children. That's a huge number. That's exercises, easy exercises that you do twice a day for about 5 or 6 minutes. So the commitment at home is very small. And if you think about those long-term consequences again to not doing anything about it, if we can do exercises, strengthening tone, coordination, all these things, and improve your airway health and keep those muscles strong, and you can reduce the severity of your apnea, that's when we get to the point where if you were diagnosed with moderate sleep apnea or even mild sleep apnea, you could potentially get off your CPAP machine. Let me say that again. If you're diagnosed with moderate or mild sleep apnea and you incorporate myofunctional therapy, you could potentially get off your CPAP machine. But again, you want to be retested, have a new sleep study, and make sure it's safe to do so. All the muscles in our body are designed to do a job. The muscles around our shoulders, our knees, our hips, in our stomach, in our back, all of our muscles have a job. And why are we not allowing the muscles in our face, in our airway, our mouth? Why are we not encouraging more of the muscle therapy to strengthen our airway to improve our health, to reduce our snoring and reduce our sleep apnea. I don't understand that. But when you have numbers and studies like that and doctors that are doing this research, it's very encouraging to see how the future of sleep apnea is going to improve with including the myofunctional therapy in the treatment plan. If this struck a chord with you, I want you to reach out to me. I also I have sleep apnea. I was diagnosed with it when I was 28. I was on a CPAP machine literally for almost 15 years until about 1 month ago when I had my tongue tie released. Okay. So all those years ago, 15 years ago, I was diagnosed with mild sleep apnea. It was like 10 events an hour. So it wasn't severe, but it was enough that it was affecting my life. And my machine is set to a pressure of 7, which is pretty low. And my machine doesn't vary. So like I mentioned earlier, some machines, they kind of vary up and down. If it's detecting changes in your oxygen and CO2 throughout the night, it's going to change that volume of air, push more air in to keep the airway open. And that's often what causes that discomfort with the machine, okay? I have not worn my CPAP machine for over a month now, and I track my sleep every night with a ring that I wear on my finger. And it tells me what my oxygen saturation is, if it detected any potential disturbances in my airway at night, and everything is pretty much as perfect as it can be. So I am also a living example of how impactful the myofunctional therapy and a possible tongue tie release can be in reducing or even eliminating your symptoms. The takeaway here is that snoring is not normal. Sleep apnea is a result, potentially, of untreated snoring when we're young. So if you're having a child that's snoring, that should be the first red flag. Remember, snoring is the sound your body is making when it is struggling to breathe. So if your child is snoring, that should be the first ding, 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 red flag. Something's wrong here. Who do I talk to about it? Reach out to us to schedule a snoring and sleep apnea discovery call. Let's talk about your symptoms. I offer you a free Zoom discovery call. We meet face to face through the computer, talk about your symptoms. I want to know what's going on. And I also want to know what you've done already, what you've tried, what you haven't tried, what's worked, what hasn't worked. And if there's a suspicion of sleep apnea, please reach out to your doctor and get tested. And then come talk to someone like me. If you're an occasional snorer and you feel good, but you know you need some extra help, come see me and then we'll figure out, okay, how can we help you? We'll monitor your symptoms, monitor your improvement, and then make sure there's no red flags happening from our end that would inhibit you from continuing treatment. So we want to make sure that you're good and clear. But get on our website, myofunctionalpathways.com. Find the schedule button, and from there, you can schedule your free discovery call. Let's talk and figure out how we can help you. As always, thanks for listening. We'll catch you next time.
And now for the fine print. The information presented in this podcast is for educational purposes only and should not be taken as medical advice. We recommend consulting with a qualified healthcare professional for any questions or concerns you may have regarding your specific health condition.